Hi, it's Jessica DaMassa with WTF Health. You're joining me here at Bayer G4A's Signing Day program. And joining me right now, I have one of the startups who's in this cohort. This is Abhi. He is the CEO of Wellthy. So Good to have you with us.
Great to be here.
So you guys have a chronic condition management app. 6 different conditions that you guys are in right now, 4 coming. Tell us a little bit about this. What are you guys doing?
Of course. So we're building scalable, affordable digital therapeutics to help the 5 billion people of the world today that don't have access to the best of healthcare that other markets do. At least that was where we started our journey. We started with diabetes. We went to hypertension, dyslipidemia, now heart failure, and other spaces in cardiology. We're doing some interesting work in respiratory, so asthma and COPD, women's health, gastro, oncology, a lot of fun stuff coming along the way. But yeah, always the patient at the center.
Okay. And now speaking of that patient, you had said a patient population that usually doesn't get much care, which is for you guys, I mean, you're based in India. And so that's your population that you're serving, right? And you're an emerging market. So talk to us a little bit about that. How does that provide a unique challenge to managing chronic conditions in India?
Of course. You have 5% of the population that actually has insurance. So 95% is actually paying out of pocket in some way. You have the cost of care is so low that for you to build health economics, you have to be really, really low as well. And that posed an interesting challenge for us, coupled with the fact that doctors don't use EMR systems, they still use pen and paper, and you have the fact that patients are not even health literate to an extent. So really interesting challenges, and then really poor healthcare infrastructure got us to begin our journey. As we began that journey, we realized that there are a bunch of different pockets, systems that have a lot of infrastructure and systems that have little. So that posed something interesting, and then we titrated along the way.
Okay, so with a patient population that is used to that kind of healthcare experience, how do you make your app sticky where they actually want to use it? Because you guys have 15,000 users, right? Yeah. So how do you make it sticky?
It's a great question. Firstly, one size does not fit all. Mm-hmm. So deep cultural adaptation, you have machine learning that actually customizes the journey for every patient, and then you learn from your mistakes, because even today we don't have 100% stickiness. So you understand what went right, what went wrong, what works for different users, and then you just titrate that back. So I think the beautiful part of being a digital health company is that you don't have to build something and perfect it on day one. You can iterate and improve, and that's the journey that we're on.
So you mentioned you do not have 100% stickiness, which is, I mean, that's a high bar to jump over, so that's fine. But you do have some clinical validation. So what have you learned so far that you've been able to prove?
We've been able to prove that when patients do engage, the reductions in, say, HbA1c for diabetes, fasting, post-meal blood sugars are fantastic. The user satisfaction is great. Doctor satisfaction is great. Medication adherence is great. And then we saw that same thing in blood pressure, where we saw reduction in systolic, diastolic pressure. We saw an improvement in your cholesterol levels. So basically, the correlation between engagement and outcomes is 100%. I think for us now, it's about how do you build this at scale? How do you go from 15,000 to 150,000 to 1.5 million? And that's an interesting problem that markets like emerging markets allow you to go after.
Yeah, very much so. I mean, I hope you're looking at Livongo.
Yeah,
they're a sponsor of this show. Anyhow, so back to Wellthy. Tell me a little bit about the business. How big are you? You guys are located in India. You've got a team in Singapore. But how many people do you have on board? And then give us a sense of where you're at from a fundraising standpoint.
Sure. We're now 100 people. So that's a new milestone for us.
Congratulations.
Thank you. So we're based in 3 cities, 2 in India and then Singapore. From a fundraising perspective, we put in a little bit of our own capital. $500,000 came from the team. Then we raised $4.5 million in seed rounds, and we're currently doing our A round as we speak.
Oh, so if anybody wants in on that, if the time is right here, you check the date on this interview. Okay, last question for you. You're here with Bayer at the G4A signing day, getting a deal with Bayer. Why? What is the attraction of working with a company like this?
So we work with a lot of pharma companies. What sets Bayer apart from the rest is they've been extremely digital health friendly and patient centric when digital health was the buzzword versus now it's mainstream. And that's incredible because that changes the organization from within. And simultaneously to that, there's always great areas where you start partnering. And cardiology, heart conditions is one where Bayer is super excited, and we have a product that we've been working on for a while. So that's a win-win. And as long as you have a great place to begin, you can start an interesting sort of partnership together. So,
well, we look forward to seeing what happens because of it. So thank you so much for joining me. Pleasure to meet you, hear about Wellthy. Thanks so much.
thank you so much for your time.
I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.